Today, we're talking about contraception, which means ways to prevent pregnancy during or after sex. There are so many options available, and knowing about them can help you make the best choices for your health and your future. Well, explore different types of contraception, both modern and traditional, so you can find what works best for you. Let's get started. The first one is artificial methods, and the second one is natural methods. But let's focus first the artificial contraceptive methods. Artificial contraceptive methods are designed to prevent pregnancy through various medical interventions, including hormonal treatments, barriers, and surgical procedures. These methods provide effective and reliable options for individuals and couples seeking to control their reproductive health. From birth control pills and condoms to intrauterine devices and sterilization, artificial methods cater to diverse needs and lifestyles.
Hello everyone. Now, let's proceed to discussing another form of artificial contraception, which is condom. So what is condom? So condom is a thin, stretchy pouches that act as a barrier to prevent sperm from reaching the egg, helping to prevent pregnancy. They also protect against sexually transmitted infections. There are two main types of condom: the male condom and the female condom. Male condoms worn over the penis, and female condoms worn inside the vagina. These are the applications on how to use condoms. For male condom, place on the tip of an erect penis, pinch the tip to leave room for semen, and roll it down to the base. For female condom, insert into the vagina and making sure the inner ring is pushed up towards the cervix. During use a new condom every time you have sex, and never use two condoms at once. It increases the risk of tearing. After use, carefully remove and dispose of it in the trash.
Contraceptive pills. What is contraceptive pills? Contraceptive pills or birth control pills are daily pills that contain hormones, usually estrogen and progestin, to prevent pregnancy. They work mainly by stopping the ovaries from releasing eggs. So, begin taking the pills as directly by your healthcare provider, usually on the first day of your period or the first Sunday after your period starts. So, take one pill at the same time every day. This consistency helps maintain hormones levels and increases effectiveness. If you miss a pill, take it as soon as you remember. If it's close to the time of your next dose, skip the mess one and continue as usual. Check the specific instruction for what to do if you miss more than one pill.
Implant. An implant is a tiny rod, like a matchstick, that doctor places under the skin in your upper arm. It slowly releases a hormone to stop you from getting pregnant. And here's some steps on how to use it. Number 1. Insertion. A doctor puts it in your arm, which takes it just a few minutes. You may feel a little pinch, and the area may feel sore for a day or 2 days. Number 2. Protection time. Once inserted, it can prevent pregnancy for 3 to 5 years. You don't need to do anything else until it's time to replace or remove it. Number 3. Removal. A doctor removes it when you want to stop or after it expires.
Tubal ligation. Tubal ligation, often called getting your tube tied, is a permanent birth control method for women. During the procedure, a doctor blocks or cuts the fallopian tube to stop eggs from reaching the uterus, preventing pregnancy.
Intrauterine devices or IUD. Instruction for use. An IUD must be inserted by a healthcare provider during a simple office visit. This usually takes just a few minutes, and we have two types of copper IUD. The first one is non-hormonal IUD, and the second one is hormonal IUD. Non-hormonal IUDs can last up to 10 years, and hormonal IUD releases hormones to prevent pregnancy and can last 3 to 7 years depending on the brand. Post-insertion care. You may experience cramping and light bleeding for a few days after insertion, and this is normal. Periodically check the strings of the IUD to ensure it's in place. Your healthcare provider will show you how to do this.
Calendar-based method. The calendar-based method is also called the rhythm method. It's a natural family planning method. It involves tracking your menstrual cycle to predict when you're most likely to be fertile or able to get pregnant, and then avoiding sex or using backup contraception during these days. So how to use the calendar-based method? Number 1. Track your cycle. Record the length of your menstrual cycle from the first day of one period to the first day of the next for at least 6 months to understand your pattern. Number 2. Identify fertile days. To estimate the start of your fertile window, subtract 18 from the number of days in your shortest cycle.
Spermicide gel. Spermicide gel is a type of birth control that you apply inside the vagina before sex. It works by killing sperms or stopping them from moving, which helps prevent pregnancy. How to use it? Number 1. Squeeze the gel into an applicator or use a pre-filled one and insert it into the vagina. Follow the instructions on the package for how much and how far to insert. Number 2. It's best to use the gel right before sex. Most spermicides work for about an hour but some may last longer. Number 3. Use a new dose every time you have sex even if it is close to the first time.
Cervical cap as birth control. A cervical cap is a small, reusable silicone cap that covers the cervix to block the sperm from reaching the egg. It's usually used with a gel that kills sperm. The advantages of this: first, no hormones or does not use hormones, so it has fewer body side effects. Second, reusable. You can use it for up to 2 years, so it saves money over time. Third, private. It can be put in a few hours before sex, so it doesn't interrupt anything.
Diputras medrocyprogesterone acetate injection. Diputras is a brand of the contraceptive injection medrocyprogesterone acetate similar to Depo-Provera. It is a hormonal birth control method that prevents pregnancy by releasing progestin, a synthetic form of the hormone progesterone.